Hi everyone, I am Dr. Pankaj Singh, Senior Consultant Gastrology at Gastropedia Clinic, Noida. Today I'll be discussing about jaundice. Jaundice is a very common clinical problem that we come across in our day-to-day clinical practice. And now, what is jaundice? Basically, in layman's term or for better understanding of the patient, we say that whenever he or she has yellowish discoloration of the eye or maybe the yellow urine, we call it as jaundice. For clinical purpose, we say when the bilirubin level in liver function test is more than 3, we do have clinical symptoms or clinically apparent jaundice. So anyone having jaundice, we try to categorize them. And now, what are the causes for jaundice? So basically, broadly, the causes of jaundice is divided into 3 categories. One is the hemolytic jaundice, where the red blood cells breaks down and they release bilirubin in the blood circulation. And the second cause is the hepatic cause or the liver related cause, where the liver cannot metabolize the excess amount of bilirubin because of the dysfunction in the liver cells, and they cause jaundice. And third category is the obstructive jaundice, where the bilirubin which is metabolized by the liver cannot be excreted in the intestine because of the obstruction in the bile duct. So these are broadly 3 classes of jaundice. Coming to the symptoms will vary depending on the types of the classification of the jaundice. Now someone basically almost everyone will have yellowish discoloration of eye, which may vary from lemon yellow in cases of hemolytic jaundice to dark yellow in those with obstructive jaundice. Apart from these, those with hepatocellular causes of jaundice like viral hepatitis can have associated fever, chills, flu-like syndrome. Hemolytic jaundice patients can have associated anemia, can have sometimes pain abdomen, and those with obstructive jaundice can have associated pain abdomen, fever with chills, other symptoms like weight loss, anemia if the cause for obstruction is malignancy or the concerning conditions. Now coming to the diagnosis of jaundice. So the first and foremost thing that we use in the diagnosis of jaundice is the blood test. We do liver function test, and there are certain parameters of certain values of all the parameters on the basis of which we decide if the person is having jaundice or not. If the bilirubin level is high, we call it as jaundice. Now if someone has, along with high bilirubin, has elevation of SGOT-PT primarily with near normal ALP and GGTP, we think that it is possibly a hepatocellular cause of jaundice. Someone with hemolytic jaundice, they do have high bilirubin, but it is the indirect fraction which is mostly predominant. So someone with indirect hyperbilirubinemia with normal SGOT-PT, ALP, GGTP is possibly suspected to have hemolytic cause for jaundice. And thirdly, if someone has high bilirubin with high ALP and GGTP, that is cholestatic pattern, is possibly suggestive of obstructive jaundice. Now, next test in evaluation is ultrasound. Ultrasound is done to look at the morphology of the liver, gallbladder, pancreas, and also some idea about the common bile duct, the dilatation of the common bile duct, whether there is some obstruction in the common bile duct. But this is just a screening test, it is not a confirmatory test. And apart from this, we also need some tests which are more specific to rule out the obstructive causes like stone stricture. We do MRCP, which also gives us fair idea about the liver morphology and also the biliary and the pancreatic pathology, which can attribute to jaundice. Apart from this, in few patients where the causes are not very clear, we do liver biopsy to understand the cause. Now, what are the causes for hemolytic jaundice? Hemolytic jaundice can be because of certain drugs which leads to destruction of the red blood cells. They can be because of autoimmune hemolysis, can be because of certain problems with the hemoglobin, like hemoglobinopathies, can be because of intensive problem with the RBCs where they swell up and break down. And the causes for hepatic jaundice are like viral hepatitis, hepatitis A, E, hepatitis B, autoimmune liver disease, drug-induced liver injury, alcoholic liver disease. These are the common causes for hepatic or the liver causes for jaundice. And then the causes for obstructive jaundice are gallstone impacting in the common bile duct, strictures in the or obstruction in the common bile duct. Then there can be gallbladder cancers, there can be worms in the CBD, there can be pancreatic tumor compressing the CBD. These are the common causes for the different forms of jaundice. Now coming to the treatment is cause specific. If there is a hemolytic jaundice, we need to figure out the cause of hemolysis and we treat them specifically. If there is a liver cause, we treat hepatitis A and E conservatively. If there is hepatitis B, we give them antiviral. And if it is autoimmune liver disease, we diagnose them conclusively. We give them steroid and immunosuppressant as in when required. And if it is a drug-induced liver injury, we try to stop the drug and give them necessary treatment for resolution for drug-induced liver injury. And then coming to the obstructive jaundice, if the cause of obstruction is the stone in the CBD, we relieve the stone with the hygroendoscopic procedure known as ERCP. If the obstruction is because of tumor like gallbladder cancer or pancreatic cancer, we diagnose them with the help of biopsy, and then some of them may be treated with the help of surgery, and few of them who are not candidate for surgery can be subjected to chemotherapy. So these are the way where how we classify jaundice, how we diagnose jaundice, and how do we treat jaundice. Thank you.